urinary bladder. What kind of receptors are here and how it works really. Yeah. Let's talk about male urinary bladder, because let's put a prostate gland here. Prostate. So we'll discuss prostate also. So what we have? We have internal sphincter and we have external sphincter. This internal sphincter is under involuntary control. Yeah, it's controlled by autonomic nervous system, and we have alpha-1 adrenergic receptors here. So activation of sympathetic nervous system stimulates alpha-1 adrenergic receptors by releasing norepinephrine, and as a result we have constriction of internal sphincter and urinary retention. Yeah, urinary retention. Also we have external sphincter, and this external sphincter under voluntary control, and we have an M subtype of receptors. This is like skeletal muscles. Yeah, an M subtype of receptors innervated by somatic nervous system. What else? We have cholinergic inputs, and we have adrenergic inputs to the bladder. From cholinergic side, we have M2 and M3 types of receptors, and activation of cholinergic inputs, let's say activation of parasympathetic nervous system, yeah, causes contraction and finally voiding, right? Voiding. What about adrenergic? Adrenergic is a sympathetic nervous system, and we know that sympathetic nervous system responsible for for fight and flight response, and it is no time for voiding during the stress. So we have beta-2 adrenergic receptors here, and beta-3 adrenergic receptors recently were described here, and activation of beta-2 and beta-3 receptors are responsible for relaxation, or let's say storage phase of the urine. Very interesting that we have purinergic receptors here also. They call P2X1 receptors, and urothelium, the cells, yeah, releases additional relaxin and constricting factors. And these additional relaxin and constrictor factors might be ATP, and ATP acts on this type of receptors, also participating in contraction. And also urothelium responsible for nitrous oxide releasing, yeah, and responsible for prostaglandins releasing, and this causes relaxation, as we should understand, relaxation.